Thank you.
Thank you, Dr. Gigi, for this invitation. It's my privilege to be here. Good afternoon, everyone. I'm Arun, founder of Janitri Innovation. Janitri itself is a Sanskrit word of mother. We are trying to focus on wearable and AI-enabled solutions to improve pregnancy and newborn care. So yes, I passed out from VIT Vellore, so 6 years I was in Vellore. I did my bachelor's in electronics, master's in biomedical engineering, and after that Vellore keeps calling me for some reason. But yes, so after I finished my master's, this was clear to me that I have to take my journey ahead as a startup by solving some grassroots level problems through technology. So what I did, I followed a biodesign process, and I've traveled almost more than 100 hospitals across the country, both in public, private, in the tertiary, secondary, primary, and got an opportunity to interact with a lot of gynecologists, staff nurses, mothers, pregnant women, newborn, and started a lot of spending time in the labor ward and all. So I think this number is very much clear to everyone that a lot of mothers and newborns, and that numbers is very high, are still dying or facing some sort of a lifelong complication during the phase of pregnancy, labor, or even after delivery. And in developing countries specifically, this number is so high, even in this 21st century. So that is where we saw the huge gap, specifically on the monitoring and early decision-making side. And let me talk about the one use case here today, which we are trying to solve, which is typically in the labor process. Once a mother starts getting the labor pain and then she gets admitted in the hospital setting, so what happens then? So when I have traveled to these hospitals, which includes PHC, CHC, tertiary hospital, both in public, private, what I found is there are a couple of parameters which are important to monitor, like heart rate of the baby, contraction, the baby kick, fetal movement, cervical dilatation, a couple of other parameters to actually track the status of mother, the fetus, and the progress of labor. But unfortunately, these monitoring was not happening at all. The reason is lower staff versus patient ratio, unaffordability, the devices are not there. We are all importing the devices, the CTG monitoring and all, which I am going to show you. If you look at on the left-hand side, these are the big machines which we are importing. It just print the output on a thermal paper. Data is not going anywhere. There is no sort of a decision-making taking place. Doctor cannot see what's happening. It's just printing on that. Mother cannot move and walk. And this is something what we have seen in the good hospital. These devices we have really not seen on the middle level hospital or the low resource kind of a hospital. That is where we saw the gap. I think our country, or specifically developing country, needs something where we make smart, easy to use and affordable wearables with an app base, so it becomes very affordable, scalable, and data-based decision making can come. So what is the existing challenges? So lack of monitoring critical vitals. Should we monitor continuously to low-risk patient versus high-risk patient? Extensive documentation during the labor phase. Ultimately, who is looking at the data and who is taking the decision based on these monitoring? And we found that gap. If you see, we have only 50 to 60,000 gynecologists, over 3 crore birth, which we are doing every year. So there is a huge gap. Who is looking at these data and who is taking decision? Who is doing those interpretation and early decision making? There are a lot of referral happening during this labor phase. Are the tertiary hospital setting getting the data in advance so they can be prepared? Who is coming for what reason? No. This is all, things are not happening. Do we have any solution which can fit in each and every kind of a facility? So these are the lot of gaps which we have identified, and how we are solving it is actually through a small patch and an app-based solution, where we have actually developed these from scratch, even the wearable and on the app base. So it can be placed on the abdomen, and it monitors a couple of critical vitals like heart rate of the baby, contraction, maternal heart rate, fetal movement, and it talks to a mobile application. So ultimately, what we are solving, it becomes so affordable. We have removed thermal printer. Everybody is carrying a phone. Ultimately, we are showing the data on the similar format to the gynecologist. But on top of what? But now the data is digital. A gynecologist wants to know the interpretation of it. As of today, they are doing the interpretation of this graph in their head. And based on the different level of experience in their different life, the interpretation might get vary. And that is where we have given them the interpretation what does it graph looks like in terms of what is the acceleration, deceleration, short-term variability, long-term variability. So their decision-making will be fast. Another thing, very important, remote monitoring. If there is a PHC and they have this device, but there is no gynecologist there, so ultimately, who is looking at this data? So there is a gynecologist who is sitting remotely, can see this data, and can further take decision that, okay, this is a severe condition, please refer the patient to the higher health facility or do this particular intervention. So this is something very basic problem which we are trying to solve through our wearable and app-based solution. So it's a very simple patch, can be placed very easily, and this is one of the problems we have solved on the hardware side. So existing Doppler and Toco-based solution needs to placed on a very specific position on the abdomen and needs to keep relocating time to time as the baby is moving down. But this, you just placed it once, till she deliver, you do not really need to relocate it. If you look at now, there were a lot of thermal paper procurement was happening on with the existing devices. Those fades away. There is no digitization. There is no data interpretation happening on there. That is where we have already calculating these interpretation on the right-hand side and making this as a part of the report. So OBGYNs can take the decision as early as possible and can further give intervention. So this is how the product looks like, different sort of a variant. Now let's come to the software, like how software is actually playing a very important role here and how this is bringing a value proposition. So ultimately, who is the end user? Ultimately, who is using the product on the mother? So it's a nurse, staff nurse, or ASHA worker, or A&M. So they are using the product, but ultimately, who is taking the decision what to do with this data is the doctor. And at the top level, let's suppose at the state level, who is taking the further decision at the administrator level? That is where the dashboard comes into picture. So our software, we have divided at 3 component level, where that it's also helping the nurse how to monitor the mother, and with some basic alerts. And further, we are showing this data to the doctor remotely with automated interpretation. And further, we are showing these data on a very good statistic manner to the top level officer, so they can actually take the decision sitting at the state level. And all 3 level actually includes some AI or ML level algorithms to give those sort of an alert to actually save life. And this is how we have divided. So ultimately, improve decision-making, improves process adherence, saves time, and overall minimal training is required for that. What we have done, if you look at the whole labor process, starting from a mother get admitted in the hospital setting till she get discharged, there are a lot of parameters which, as of today even, it's a full labor case sheet which each and every hospital who is providing the maternity services are using. We have brought each and every parameter of that whole process, which is typically 48 hours to 96 hours, into our application. So now, instead of using this paper case sheet, they can actually use this app to actually fulfill all these process parameter with some intelligent alarms, so it can help them in process adherence and decision making. And further, they can take the printout of the case sheet for their medico-legal concern. How the referral feature is working using the power of digital, this is how I've explained. So from PHC to CHC to the district hospital or medical college, this is how the referral is going forward. So if they have our system in each facility, they can take the decision of early referral based on the monitoring, and they can further refer to the higher health facility, and they will get to know who is coming from which facility for what reason, and they will be prepared in advance. And that is what it doesn't exist as of today. So yeah, this is a little old side, but now we are in almost 300 plus hospitals, more than 75,000 mothers have been monitored, more than 3,000 lives have been saved based on the automated alerts, referral, and intervention. These are a couple of studies which we have done in collaboration with Karnataka, Rajasthan government, and actually proved how these affordable, easy to use, wearable labor monitoring solution can actually save life and can actually help in preventing the infant mortality or maternal mortality. I'll just give you a very simple, basic example which took place in one of the PHC in Rajasthan. So we have deployed our wearable and app in PHC. A mother came with a labor pain, and the staff nurses have placed the patch connected with our mobile phone, and they started monitoring FHR, contraction, maternal heart rate. And the staff nurse went away to do some other work. After some time, both the device and app have started giving alert for the abnormal fetal heart rate value. And it was a continuous alert. So here the staff, nurse, and the doctor have decided to refer the patient to the higher health facility, which is the district hospital, on time. And that is where they found that it was cord around the neck, which was causing problem. And they could able to save both mother and baby by doing C-section. And that is why these monitoring and early alerts are very, very important to actually save life. And that is how this AI and ML algorithms are actually taking in shape for early prevention. So let's innovate for saving life at birth. Thank you.
Thank you, Arun. If there are any questions, we'll allow a couple for both the talks. Arun, how sure are you of the trace not being the maternal trace? What are the precautions you've taken to avoid contamination?
Yeah, so I think this is very important because the technology which we are using works on the electrical signal principle, where we are picking up a lot of electrical signal from the mother's abdomen. And what we actually picking up is the fetal ECG, maternal ECG, uterine electromyography. And that is where the AI algorithms are coming into picture, where we are putting a lot of data to actually get to know the fetal ECG. And that is where it is important, like these are two separate kind of extraction.
One question. Thank you. Wonderful innovation. Have you looked at deploying this outside of India? And do you think there will be buy-in from technologically advanced countries for simple, cheaper solutions?
Yeah, so if you look at the other countries, like we have already exported to African countries, South America, because these countries have a very similar geography, very similar problem, and in terms of target user affordability, and also we have already started exporting that.
Thank you.
Thank you.
It's a very impressive product, and I really like that it's aimed at at communities. I just wanted to know, has it been validated in any clinical setting or studies?
So it has gone through multiple validation at multiple hospitals like St. John's Medical College, Bangalore, AIIMS Delhi, AIIMS Jodhpur. We have deployed in CMC Vellore also, so there's one more validation is happening here. So a couple of publication out also there in the market.
It's there. Okay.
Hi, thank you for a great presentation, great product. I was wondering, as a startup in India, how much are you forced to open such things up, right? So, of course, you're focusing on creating value for patients, right? But are you also forced, for instance, to make sure all your data is available via a FHIR interface or an API, that they force you to be interoperable with other systems? Or can you just close it all down and say, this is my product, and if you want a connectivity, you have to buy my product, which is good for startups, right? I don't necessarily disagree with that. But
No, the right question. So definitely, when you start developing the product, you have to make as a closed product, but you have to be very open in terms of those API and SDK integration, which we have also done with a couple of other hospitals and organizations. So it completely depends on the hospital and organization, what kind of an integration they are looking for. So as a company, we have done these integration. For example, there was a company who were having some sort of a full pregnancy related mobile application, and they wanted to integrate our wearable with that application. So we have given them SDK. Some other company, they wanted our application to use, but they want that data to go to their server. So we have done the API integration in that way. So it just completely depend on use case basis, but we have to be open for our scale up. Thank you.
Oh,
what is the
there's
cost?
one more question which,
Just what is the cost?
So yeah, so we, as I mentioned that we have designed the product considering the multiple kind of a facility, starting from 30,000 rupee goes up to 2 lakh rupee. So it's completely depend on the use case, type of facility, number of deliveries, and the feature you want. Thank you.
thank you.